It gives me great pleasure to kick off our third season of Here for Good. While 2022 has already had a challenging start, I can't help but feel a sense of optimism every time I sit down in front of this mic and speak with fascinating and impactful leaders. With that, I'm pleased to welcome this year's first guest, Geoff Martha. Geoff is chairman and CEO of Medtronic, the global leader in healthcare technology. As chairman and CEO, Geoff leads a $30 billion company and its over 90,000 employees in pursuit of fulfilling Medtronic's mission to use technology to improve human welfare. He's recognized as a driven and innovative leader, ranking in Modern Healthcare 100 most influential people in healthcare in 2020, and listed as the #1 CEO in healthcare technology by the Healthcare Technology Report in 2021. Fortune magazine named Medtronic among the top 15 companies for its 2020 Change the World list, and listed the organization on its 2021 Most Admired Companies. Geoff is a member of the Business Roundtable and the World Economic Forum's International Business Council, an ardent supporter of philanthropic and diversity initiatives. Geoff serves on the board of directors for the Medtronic Foundation, Children's HeartLink, and the Northside Achievement Zone. He's also part of 110, a coalition of cross-industry leaders committed to breaking down systemic barriers for Black Americans. Geoff is a proud alumni of Penn State University, where he also served as captain of the men's hockey team and later inducted into his Hall of Fame. Geoff, welcome to Here for Good.
Hey, thanks, Dennis. I really appreciate you inviting me on. As this podcast has really gained a lot of followers, and you've had a distinguished list of guests. I hope I can hold up the tradition here.
I have no doubt that you will. You know, Geoff, growing up in Texas, I think I was an adult before I even knew hockey existed, but we'll talk about that later in the conversation. You know, and you can't start a conversation with a leader today without framing it in the context of the global pandemic. You know, I know that you've been with Medtronic for over 10 years, but you stepped into your role as CEO in April of 2020, right at the height of the pandemic. You know, I think starting any new role during a global pandemic is challenging, but to assume the role of CEO for a company as large and as influential as Medtronic, what was that like for you?
Well, I'll tell you, it's been intense, you know, and I still, it all started in that March, April timeframe, when I was not even officially CEO yet, and I was trying to get a workout in my basement in my house, and I kept my phone on because I knew there was a lot going on in the world, and I started getting that Sunday afternoon after one of your colleagues, Michael Dowling from Northwell, CEO of Northwell Health, and the governor of New York came out and said on that weekend that we need 500,000 ventilators just for New York City. And that started an avalanche of demand for ventilators, we can talk about later. But I started getting calls from the White House, from other heads of state, from governors in the United States. And I knew my life would be different. And that kicked off this pandemic. And as you know, and many on your podcast, everybody in your podcast knows, the pandemic is here we are over 2 years later, right, still dealing, with that pandemic and different implications, in terms of supply chain issues, and not to mention the global health implications, along the way, the world, the United States and Minneapolis being one of the hotbeds of racial strife. There's just a lot has gone on. You've had the Great Resignation, people leaving the workforce. All of this really intensified, roles of CEOs. And I'd say, one thing that a big change for any CEO, and maybe particularly challenge for a new CEO, is just how the roles evolved in the last 2 years. It's gone way beyond a business role. And I don't know if you've heard of the Edelman Trust Barometer. It's a survey
Right.
that is pretty well recognized. And over the last 2 years, unfortunately, governments and NGOs and news organizations, the people's trust in them have come way down. And I'm
A lot
not
of people
sure
don't
that
realize you didn't have a playbook to
no,
deal with this. I mean, so here you are coming in as a new CEO in probably one of the world's largest global organizations without a playbook to deal with the craziness that ensued with the pandemic.
right, no playbook. And like I said, the role evolved. Like as these other organizations' trust came down, employees are looking to CEOs to be more than business leaders,
Yeah.
to be infectious disease experts, to be mental health experts, to be politicians and dealing with things like racial strife, and obviously we're not experts in all those areas.
Mm.
And employees are looking for a different style of leadership from business executives like yourself, like myself, whether you're running a hospital or a healthcare organization like Medtronic, or a company like Walmart or whatever. Employees and community expectations from these business leaders have changed, evolved, and gone up.
Jeff, over the last couple of years, I've had an opportunity to speak with a number of individuals in different industries about the impact of the pandemic on leadership decisions, sort of like what you were talking about. Is there or was there a particular moment from the last few years that stand out to you as being sort of a defining moment in your career?
Over the last 2 years, there's many important moments. Whether the defining moments in my career or not, I'll have to look back in a few years and make that determination. But things like we touched on the ventilators, things like open sourcing our ventilator IP and how we address the global shortage of ventilators, and putting the needs of other stakeholders above Medtronic's. I mean, I think that was one. Um, you know. A couple others were just decisions we made around the business to keep it going despite a dramatic drop in demand, because as you well know, procedures in hospitals, elective procedures in hospitals went way down during COVID. Our that impacted our revenue and our income, and how we reacted to that, to not furlough employees and to keep our factories going. Those were big decisions. And at the same time, I do anticipate this pandemic ending. And one of the things going into before the pandemic that me and my leadership team had decided was we wanted to really transform Medtronic to get it to that next level of performance and growth and innovation. And so we reorganized our whole company in during the pandemic to make it, in many respects rather, more nimble and more improve the pace and cadence of innovation. And at the same time, trying to leverage some of our economies of scale. We call it playing small and playing big at the same time. So these three things really stepping up for the world in terms of ventilators, stepping up for our healthcare stakeholders and our employees in terms of keeping our factories running and all systems go during a really difficult business environment, and then transforming the company. These three decisions, I think, as you look back in time, I don't know if they'll all be defining moments, but certainly big moments for me individually as a business leader, but more importantly as a person.
Yeah. So you talked about, your team shifting, things in terms of production, in terms of operations, and clearly a shift in mindset in order to be able to respond quick enough.
Right.
Um, what was it, how do you think your team really adjusted? I mean, I know from a leadership perspective, the executives, we think about these things and we try and make sure that they're implemented. But the organization, do you find that there was a real shift in mindset and understanding what we now have to be here for a nation, for a world in a very different way. Was that a difficult shift, getting people to start thinking differently?
Well, we had the privilege, if you will, of having this ventilator opportunity right in front of us, and we had to ramp up our ventilator supply, over 5x our own supply, and then we enabled other companies to to manufacture ventilators for the world. The going through that opened our eyes on several different things. Opened our eyes that as a healthcare technology company, we play a bigger role. Technology is critical, to healthcare, to meeting the triple aim of healthcare in terms of improving outcomes and improving access and reducing costs. And that became so clear during the pandemic. And so we really decided, hey, look, if we can have even a bigger impact. Medtronic's had a huge impact on technology and healthcare in the world over the last 70 years, but that we're only scratching the surface. We serve 2 patients every second. That's 75 million patients a year. That sounds like a lot, but there's 8 billion people, Dennis, in the world. Yeah. So we've reframed, okay? Coming out of the pandemic, this ventilator experience just reframed our thinking to think much bigger around the impact that we could have, should have, and in many ways are obligated to deliver. And that's our mindset has shifted so much so that we've kind of, characterized it and even internally branded it the Medtronic mindset. We've always had a mission that our founder wrote 60 years ago that has really guided us through these past 60 years through so many ups and downs. But we decided to, alongside of it, encapsulate this Medtronic mission, which talks about thinking bigger, moving faster, and it's really we've grabbed onto it. I mean, I still don't think we've fully internalized it yet, but it's an exciting time. And like I said, we're thinking bigger now.
Geoff, you said a word that I want to sort of focus on right now. You said reframe. So if I look at the 3 or 4 people who have listened to Here for Good over the last 3 seasons, know that I take inclusion, diversity, and equity efforts, both internally and in the community, very seriously. And I know you are authentically committed to IDE within your organization. Why do you believe this is important to the success of your business?
Look, I am firmly convinced and believe that diversity of thought and experience and background leads to better decisions, and in our case leads to more impactful innovation. And gender and race and are leading indicators of that, and gender and race diversity. I just want a team that has different points of view, different life experiences, and so that is the business rationale for it. Besides that, it feels always intuitively felt like the right thing for me, and I've had the honor of working alongside my predecessor Omar Ishrak for 15 years. He's born in Bangladesh, grew up in India, spent a lot of his education in London, and then came to the United States. And he's a global health champion and a champion for diversity and inclusion. And he, over the last 15 years, just kind of opened my eyes to the power of ID&E, the power of listening and breaking down barriers for people of all different backgrounds, and really to put yourself in their shoes and really understand how some of the obstacles that they have faced and are facing that you might not really realize. And as I've learned to do that over the years, it's just been an incredibly rewarding, and it's paid off from a business perspective as well. And
are you doing anything unique within your organization to help not only promote but sustain that?
Well, sure. I mean, there's a lot of things. I mean, I think, one is we've created these networks. You hear about employee resource groups. We have lots of those, but we've created, those are more grassroots. But we've created some, I'll call them top-down networks for, people of African American descent, Hispanic descent, Asian descent, a women's network, as well as LGBTQ plus. Those 5 are top down and create all kinds of forums to convene not just that cohort of employees, but other employees around it that become champions for diversity and inclusion. We drive awareness and education, development programs all around these networks. Beyond that, I think just broadly defined, it's about, we're more aggressively recruiting diverse talent, developing and engaging diverse talent, and then engaging them for retention. And that's led to all kinds of development programs, all kinds of partnerships. Like over the course of the last 2 years, we developed a partnership with the Thurgood Marshall College Fund, we're on our second intern. We've had like 60 or 70 interns a year from the historically Black colleges, and that leads to full-time offers, and we're paying for their college education, and that helps us fill the entry-level part of our funnel. And we've got programs like that across all these different, ethnic and gender, areas. So these are some of the things, the partnerships. 110 you mentioned, really reaching out beyond Medtronic's 4 walls to collaborate with other companies to do this, because we can't do this by ourselves, and to collaborate with communities. So we're doing things inside Medtronic, we're doing things in the communities, and then we're partnering with other like-minded companies. Like 110 is a great example to move this forward. And it's really energized. I'll say one thing and I'll stop. It's really energized our employee base. And I'll tell you, Dennis, I mean, look, we're a tech company. Tech innovation is a people-powered business. And to attract and retain the best talent of any color, any race, any gender, ID&E is what our employees want: an inclusive environment, and an environment with no barriers, so that there's no barriers to get to the top of the company. We're not at that no barriers level yet, but we are. That's our North Star, and we're working towards that. A lot of work to do, but proud of what we've accomplished.
Yeah, Geoff, you're right. There's a lot of work to be done by all of us, but I can tell you're setting a great example. And I can't thank you enough for the work that you are doing, not only with Medtronic, but globally, because it sort of sets a bar for all of us to try and achieve. So I'm going to deviate for just a moment and start with a brief commercial moment for Virtua. Virtua recently announced a new partnership with Medtronic and a collaboration with Medtronic Labs, focused on improving the delivery of quality care for residents in underserved communities. So let's talk about what this means, as well as the role you believe, as you just mentioned, technology has in improving community health and reducing disparities in care. I know you guys started outside the country and are now looking to do some things within the state. Share a little bit about Medtronic Labs and the commitment there.
Sure. So Medtronic Labs, just a brief history on that. It started about 10 years ago. And I was part of the initial beginning with my predecessor, Omar, myself, and some very passionate volunteers within Medtronic to start working on global health opportunities around the world for these underserved communities. How can you provide scalable, sustainable healthcare solutions in these low resource environments? And those are key words: scalable and sustainable. We don't want to just help 10 people. We want to be able to help millions of people. And it's got to be that scale, and it's got to be sustainable. It can't rely on just charity every year. You've got to get it to the point where it's self-sustaining. So, these solutions create, although small amounts, but they do create revenue that when it comes to Medtronic Labs, all of that revenue goes back into investing in the business. So we don't make money.
Yeah, not only interrupt you, but Geoff, isn't that one of the challenges with a lot of organizations when they look at doing programs of this nature? They think, well, is there, or maybe there's not an ROI, so why should we do it? But you're talking about there is a return on that investment, not always that can be monetized, but you actually see the value of contributing to programs of this nature.
Right. I think, and it's been hard. I'm not going to, lie and say it's all it's been all roses, and 10 years is a long time for us to a lot of trials, a lot of failures, a lot of repivoting. But in the areas of hypertension, heart failure, those chronic conditions, and then something that's a little more nichey, but still a huge impact, hearing. We've created these solutions that I believe are scalable, sustainable. We've convened partners from governments in sub-Saharan Africa and the Philippines and other partners in terms of pharma companies and other med tech companies. We've convened these, and like I said, we're able to generate within Labs, which is a wholly owned kind of entity within Medtronic, a per procedure business model where we get some revenue, and that revenue all goes back to kind of investing in the sustainability of the business. And again, the ROI may not show up for Medtronic in terms of like dollars, but it shows up in terms of our ability to attract and retain the best talent in the world. Because the best talent in the world, Dennis, believe it or not, they want to do good for the world.
Exactly.
And so we're attracting the best people because this is they get that opportunity to potentially work on something like this. And so now, and I go to a commercial here for Virtua as well to pile on, the idea of bringing this solution back into some of the underserved communities around the United States, that came to us during the pandemic. And we started talking to leading healthcare providers like yourself around the country about different opportunities to partner. And this always comes to the top of the list. And you, Virtua, you're the first ones to really decide to collaborate with us and move forward in some of the underserved communities around you, like Camden. And I couldn't be more proud and excited and to do this and to partner with Virtua. And let me say one thing about ID&E that's the most critical thing, and that is authenticity. This can't be we're doing it because it's the politically correct thing to do. The leadership, and not just the leadership, but down into the different organizations, you have to be authentically committed to this. I feel that we are that way at Medtronic, and we feel the same about Virtua. So I'm optimistic about what we can do. The challenges are tough, but I think we can make a difference here, Dennis.
And you said it's about leadership. And so prior to, I joked at the beginning, but prior to your career, your passion around hockey, you were captain of the men's hockey team at Penn State, an inductee into the Hall of Fame. You received the Penn State Hockey Distinguished Alumni Award, and I know you have credited your years in sports as preparing you to become a leader. Did you know at the time that the sport that you loved was preparing you?
No, I didn't fully appreciate that. I knew that there was value beyond the fun of playing ice hockey and the fun I had with my teammates, and as it was.
I mentioned to you there was no ice hockey in Texas where I grew up.
Hey, but now
it is, but not back when I was in high school.
It's spreading around. You want to get on board here, Des. It's in Vegas now. It's everywhere. The NHL's spreading out. Now it's a great product. The hockey players are just great human beings in addition to unbelievable athletes. I didn't achieve that level, but I really had a great time at Penn State, and it did teach me a lot. It taught me how to work on a team, and look, business is all about teamwork is a big part of that. And some days you're in the spotlight scoring a goal, but most times you're kind of in the background, just part of that success. And I think the most memorable play of my career, I actually got leveled. Checked into the boards, and when I got up, I was seeing stars. But right before I got hit, I made a pass to one guy who made a pass to another guy who scored the game-winning goal in a national championship game for us. And that play right there kind of epitomizes my career and what I strive to be like. So it taught me that teamwork, and it taught me humility. Right? I mean, every time we thought we were good, or there was some other team better and some other player better. It taught me about humility and hard work, and it really has paid off way more than I would have ever have dreamed.
I tried playing football for one play. I got hit, then I hit the locker room and didn't put cleats on after that ever again. So I can appreciate the fact that you got hit. A lot of people might not know certain things about Medtronic, What is it that you think that you would like to share about your organization that many would find surprising or may not know that's embedded in a global organization like Medtronic?
Well, I know I spent 20 years at General Electric before coming to Medtronic, and I remember interviewing at Medtronic, and they talked about their mission and how it's a mission-driven organization. And I really struggled with how can a company as big as Medtronic, that's for profit, be truly a mission-driven company. I thought that was for charities and things like that. But our mission, written 60 years ago by our founder, the company was founded 70 years ago. Mission was written 60 years ago because it started a really good growth trajectory, and then it grew too fast and almost went bankrupt. And Earl Bakken decided to write a mission to say we got to stick to what we're good at. We got to have a North Star, and our North Star is about patients and driving outcomes for patients. It talks about the personal worth of employees. It talks about being a good corporate citizen. There was no such thing in 1960 as corporate citizenship. That was a foreign concept. Our founder was way ahead of his time, and this mission is truly embedded into this company's DNA. And each and every employee can cite the tagline of the mission and probably all 6 tenets. But tagline being alleviate pain, restore health, and extend life really defines who we are. And many people just don't recognize that a large corporation that is for profit, that does make good money for shareholders and good returns for shareholders, can be mission driven as well. So that is the one thing. And it is, Dennis, it is authentic. This is not marketing. This is who we are. And I'm just proud to be part of it and to play a role in carrying that on and evolving how that mission applies to the current state of the world. So that's probably the most important thing to know about Medtronic.
And I love the fact that you are committed to using technology to impact
Right.
and improve, human welfare. Anything on the horizon that we might get a sneak peek or something
Oh,
special that Medtronic's working on that
sure. I should have brought
that's
some
going to be
toys. I mean, look,
transformational?
yeah, I think, look, I a couple of themes. One is robotics and surgery, and we just launched a surgical robot in Europe, and we'll be launching it here in the United States soon. We got a robot for spine surgery, for brain surgery. So I think the impact of robotics to improve and surgery and take out the variation, and then take those robots to India and China where you don't have the same training of physicians, same level of care. Another one is the miniaturization of electronics and how those electronics are all connected now through 5G, and so the ability to remotely monitor patients and make adjustments to their health before they know there's a problem is one. And then just the convergence of technologies. I'll give you one that I know that a lot of people listening to your podcast will resonate with is colonoscopies. It's now recommended for people to get colonoscopies at 45. We all know the process and the concept of it, and with the camera going, into places, you don't want it to go. Now we are changing that to a pill. So it's about the size of a multivitamin. You swallow this pill. You still have to do a little bit of the prep. You have to do that to clean out your colon. But the pill has imaging technology in it, images your colon, beams those images to your phone into the cloud, where we do your colonoscopy in the cloud using our AI, which has been proven in clinical studies to be significantly more effective than a surgeon's eyes during an actual colonoscopy procedure. And 7 out of 10 colonoscopies, you don't find a problem. And so those 7 people don't have to go in for that traditional procedure. The 3 that the AI picks up a problem with, or like a polyp or worse yet, maybe cancer, then would go in for a traditional therapeutic colonoscopy. But this is an example of how technology is hitting all 3 of these things. You're going to get better outcomes. Like I said, our clinical trials prove that it's better than a traditional colonoscopy in terms of diagnostic sensitivity. 2, access. It's creating all kinds of access. Many parts of the world, even in the United States, people don't have access to
care.
A hospital like yours to go in and have anesthesia and have 2 well-trained physicians perform a colonoscopy. And 3rd, it's lowering cost. And we just announced yesterday on our earnings call that we're partnering with the Gastrointestinal Endoscopy Society and Amazon, right? Talk about convergence of technology, Amazon Web Services, to provide this technology, not the pill cam yet, but the AI 2 colonoscopy centers in underserved communities around the United States. So provide that for free to make sure that people in underserved communities get access to leading edge technology. And when the pill is approved in the United States, we'll do something similar with the pill. But that's a teaser for what's to come, and it really exemplifies how technology is reshaping things.
Now, you suggested that all the people that listen to my podcast are old people that need colonoscopies. So I'll let
I don't
that
see
one.
45 as old. I don't. I've been talking about reframing. I've
Okay.
reframed what I think is old.
Okay,
45 is
I'll
not
let
old
that
yet.
one slide. But you've been such a great guest, but I can't let you leave without my last question.
Yeah.
What would your 18-year-old self think about who you are today?
That's a great question. I think first 18-year-old Geoff would be a tad bit disappointed that he never played in the NHL. But that being said, I think he would be super proud and amazed that he became CEO of a company the size and scale and impact of Medtronic. I mean, I grew up in Pittsburgh, on the other side of the state. I know you're in the southern Jersey, but you branch into Pennsylvania a little bit here, but other side of the state. And I never knew of a CEO. Our family didn't know anybody like that, and so to achieve that, he'd be pretty proud. But the one thing I'd say, 18-year-old Geoff would underestimate. He'd probably focus on that accomplishment, but underestimate the fact that I was able to do this and have a family at the same time. And my wife and I are coming up on our 27th anniversary. We just launched two kids. One's fully launched and employed after college. The other one's still a junior in college, but partially launched. And to be able to maintain a career and to do that, and I get so much fulfillment from that. And I didn't really recognize how hard that would be, as an 18-year-old. I just kind of thought, I took that as a given that you would maintain your family, but to do all that, and I'm really proud of that. And I don't think 18-year-old Geoff had any idea what kind of fulfillment you get from that.
Well, Geoff, I can't thank you enough for spending time with me. The work that you are doing personally, as well as the work that your organization is doing, I think is meaningful, it's impactful, and it's transformative. So thank you for all that you're doing. I'm excited about our partnership, and I look forward to our continued success together. And thank you for being on Here for Good.
Well, thank you for having me, and I too echo your sentiments. I'm really excited about our collaboration and where we're going to take it with Virtua. I'm really excited, and thank you for your trust in us.
Great. I look forward to speaking with you soon.